Hello, my name is Johnny and I am going to be going over the echo views. Transducer indicator is used for proper orientation of the heart, and transducer movements are required to find good acoustic windows, and these are usually very slight movements. How to get personal long axis left ventricle. We're going to place the probe between the third and fourth intercostal space. The notch should be facing the right shoulder, perpendicular to the chest wall, and the patient will be on the left side. Once you get all of that, this image should come up on your screen. Structures we see in peristernal long axis left ventricle. We see the left ventricle, left atrium, aorta, and right ventricle. We will assess the size and function of the left ventricle, put colorful Doppler over the mitral valve and aortic valve, and assess valves for prolapse or calcification. We can also check for pericardial effusion under. Right ventricle inflow tract, RVIT, is the same patient position, same transducer location on chest, still in personal long axis, we're just changing the angle. How to get RVIT. We're going to be the same position and everything. We're just going to be angling the probe a bit inferiorly and medially towards the patient's right hip, and the right atrium, right ventricle, and tricuspid valve will come into play. The structures we saw was right ventricle, right atrium, tricuspid valve, and this is the posterior leaflet and the anterior leaflet to the tricuspid. Sometimes you will see the inferior vena cava as well. Peristernal short axis. This is the same patient position, same transducer location on chest, rotator transducer. It's just four different levels to the peristernal short axis, four different views. These are the four different views we will be going over. How to get peristernal short axis aorta valve level. We'll be in the third to fourth intercostal space. Rotate the probe 90 degrees clockwise from peristernal long axis. Notch should be facing the left shoulder now and leaning slightly away from the patient's right shoulder, perpendicular to the chest wall. So we will be in the number 1 indicator right here and also right here. And this is the closest to the base. So this is the top bar right here going across the heart. So what do we see in the peristernal short axis aortic valve level? We see the chamber's left atrium, right ventricle. We see the aortic valve, tricuspid valve, and pulmonic valve. We can check for regurgitation in tricuspid valve and pulmonic valve via pulsed wave and continuous wave, also colorful Doppler. We can check for calcification of the aortic valve, and sometimes we can see the pulmonary artery, which you can't see in this diagram, but we can see in this picture over here. To get peristernal short axis mitral level, we'll be in the third to fourth intercostal space again. We're going to angle or slide down from the aortic valve level. The angle should be more inferior, as we can see right here, the number 2 and number 2. We will also be in the mid-heart. We will know we're in this right position when we see the fish mouth right here. So what do we see in peristernal short axis mitral level? We see the mitral valve, it's a ventricular septum, and the right ventricle. We'll be cutting across like this. You can see the fish mouth I was talking about earlier. This is the mitral valve opening and closing. You assess the mitral valve for opening and closing, systolic and diastolic. It's a ventricular septum shape. How to get peristernal short axis papillary muscle level. We'll be in the fourth intercostal space. We're going to angle or slide down from the mitral valve level, and we will be in this space right here. It's not in the picture, but I added a red line right here to indicate where we will be at, and we will see this mushroom outline. Peristernal short axis papillary muscle level. We will see the left ventricle, anteventricular septum, right ventricle, papillary muscles, and the left ventricle wall. We're going to check the chamber size and function of the left ventricle mainly, the systolic and diastolic interventricular shape, and thickening and motion of surrounding wall. So the wall motion abnormalities right here. How to get personal short axis apex level. This is the last view we have. We've been in the fourth intercostal space, but we may have to move down an intercostal space if needed. We're going to slightly angle down from papillary muscle. So we will see a kind of like a donut hole. Personal short axis apex level. We will see the left ventricle cavity, the lateral wall, inferior wall, septal wall, and anterior wall. We're going to be checking for the chamber size and function of the left ventricle, thickening and motion surrounding the walls. We're checking for wall motion abnormalities. Reviews. Same patient position, different probe location, 4 different views to the apical, and we're going to increase our depth. How to get apical forechamber. Place the probe at the point of maximum apical impulse on the patient's left side. The knot should be facing you or towards the floor. Angle slightly up, but not too much where the 5 chamber comes in. And the IVS should be parallel. If foreshortened, move more posterior or inferior. Apical forechamber. What do we see? We see the right atrium, the left atrium, the 2 valves, the tricuspid valve, mitral valve, right ventricle, left ventricle, the interventricular septum, and the interatrial septum, but this might not be a good view for that. The chamber size, we'll check for the chamber size of all 4 chambers, function of the ventricles, assess for mitral valve regurgitation and tricuspid valve regurgitation, and we get to the left ventricle ejection fraction right here. To get apical 5 chamber, we'll be in the same position as 4 chamber. We're just going to angle slightly up until the aorta comes in. If foreshortened, move more posterior inferiorly again. What do we see in apical 5 chamber? Well, it's similar to 4 chamber. The only difference is the aorta will come in and sometimes the right atrium will disappear. So in this diagram, you can see that right atrium is not visible. In this one, you can see that it is there. In this picture, we can see the right atrium disappearing, but in this picture, we can see that it's still there. So it just depends on the patient. Assess for mitral valve regurgitation and aortic insufficiency. We will assess also for the left ventricular outflow tract, the aortic valve, and aortic root. How to get apical 2 chamber. The same probe position, rotate 60 to 90 degrees counterclockwise from 4 chamber. If foreshortened, move more posterior and inferiorly, and you should just see 2 chambers. Apical 2 chambers, what do we see? We see the left atrium and the left ventricle, the inferior wall and anterior wall. We're just going to be checking for the chamber size of the left ventricle and left atrium, assess for mitral valve prolapse and mitral valve regurgitation, and we will do the ejection fraction of the left ventricle here. How to get apical 3 chamber. Same probe position, rotate 30 to 60 degrees counterclockwise from 2 chamber. Indicator should be facing the patient's right shoulder now, and the aorta will come into play. What do we see in apical 3 chamber? Well, it's the same thing as 2 chamber. It's just the aorta will come in. We'll be assessing the chamber size, function, and wall thickness, valvular function, and aortic size. We can assess for mitral regurgitation and aortic insufficiency right here. Subcostal views. The patient will be supine with bent legs. This is a different probe location. 2 main views. We will have to increase our depth, and you may have to ask the patient to breathe in and hold for these views. How to get subcostal 4 chamber. We will place the probe 2 to 3 centimeters below the sternum and the xiphoid process. The indicator should be facing you for the patient's left side, and we must angle up since we are very inferiorly. to the patient's heart. Subcostal four-chamber. This is similar to the apical four-chamber. We will assess chamber size and function, assess for PFO, and check for pericardial effusion. We can see the left atrium, right ventricle, and the left ventricle. The mitral valve and tricuspid valve. We will check for the pan-foraminal valve right here with colorful Doppler to see if there's any blood flow coming through. How to get subcostal inferior vena cava. This is the same probe position. We just rotate 90 degrees counterclockwise from subcostal four-chamber. The indicator should be facing the patient's head now. Subcostal IVC. What do we see? We see the inferior vena cava, right atrium, and hepatic vein. In younger people, you will also see the superior vena cava on the other side of the right atrium. We will be assessing for the IVC diameter and collapse when they sniff. Views. We went over the peristernal long, peristernal short, apical, and subcostal views.